Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
If you're one of the tens of millions of people who suffer from hand and wrist pain due to carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, then like almost everyone, you probably reach for non-steroidal anti-inflammatory painkillers. But would you so readily take these drugs if you knew that they were extremely dangerous? As explained by the United States Institute of Medicine, all drugs, by the very nature of their action, are toxic to the body. But we tend to overlook these dangerous side effects with NSAID painkillers because they relieve pain. Yet some of the most popular painkillers are responsible for over 16,000 deaths per year as a result of toxicity to organs and other problems. Thus, the most relied on painkillers are actually killing the people who are taking them, and who trust in the companies that make these drugs. The problem is so severe that each year more people die from NSAID painkiller complications than from AIDS and cervical cancer in the United States. And year after year, reports are published that substantiate this significant public health problem. So if you can't take these medicines for your hand pain due to carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, what can you do? Wrist tendonitis and repetitive strain injury are much easier to treat than carpal tunnel syndrome. But if you're thinking of having surgery to treat your carpal tunnel syndrome, discuss with your doctor the fact that most people who have surgery for their carpal tunnel syndrome are dissatisfied with their results, but the overwhelming majority of people who treat with non-surgical therapy are quite satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapy options are rest, night splinting, and deep tissue massage. These simple methods are very effective in relieving symptoms. In fact, deep tissue massage is nearly 100% effective, but only if it's used daily and for 2 to 4 weeks. Anything less is ineffective. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that, over time, will drain excess fluid and break up adhesions over the flexor tendons. This will reduce inflammation, thus reducing your hand pain and other symptoms. So as you see, you don't need surgery, especially to treat carpal tunnel syndrome. Instead, professional deep tissue massage applied daily will be nearly 100% effective in alleviating your symptoms. To get this professional therapy for these conditions causing your hand pain, you don't have to visit a therapist every day. Instead, the Carpal Rx will give you the same therapy at home. If you have hand pain due to carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal Rx. If the Carpal Rx doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers, treating you for carpal tunnel syndrome, wrist tendonitis, or repetitive strain, except it treats you every day at a fraction of the cost of a therapist and in the comfort of your home. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. The Carpal Rx always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal Rx at carpalrx.com.